Hello everyone, and welcome to our YouTube channel on health. Today, we'll be exploring an important health issue that many people are facing: high blood pressure, also known as hypertension. We'll delve into the causes, risks, and treatment options so you can maintain a healthy life. What is high blood pressure? High blood pressure, or hypertension, is a chronic condition defined when blood pressure measured in a clinical setting is equal to or greater than 140/90 mmHg, as recommended by the National Heart Association for the diagnosis and treatment of hypertension. Prehypertension falls in the range of 120/139/80/89 mmHg, and normal blood pressure is below 120/80 mmHg. What are the causes of high blood pressure? In the majority of cases, hypertension in adults has no specific cause, essential or primary hypertension, accounting for about 90% of cases. However, approximately 10% of cases have a known cause, referred to as secondary hypertension. Primary hypertension, essential. About 90% of cases have no identifiable cause. Family history plays a role. It often runs in families, especially in older individuals or those with diabetes. Other factors contributing to high blood pressure include a high-sodium diet, smoking, excessive alcohol consumption, overweight or obesity, lack of physical activity, stress, and life pressures. Secondary hypertension. When a specific cause can be identified, it's known as secondary hypertension. It accounts for around 10% of cases and can often be cured if the underlying cause is treated. Common causes include kidney diseases, example, glomerulonephritis, renal artery stenosis, chronic kidney disease, disorders of the adrenal glands, located above each kidney, endocrine disorders, example, hyperthyroidism, Cushing's syndrome, certain medications, such as corticosteroids, nonsteroidal anti-inflammatory drugs, birth control pills, sleep apnea, and congenital heart diseases causing narrowing of the aorta. Common symptoms of high blood pressure. People with high blood pressure may experience symptoms such as
1. Headaches. 2. Dizziness. 3. Neck pain. 4. Drowsiness. 5. Flushing. 6. However, around 1/3 of individuals with high blood pressure don't experience any symptoms and may only discover the condition through routine blood pressure checks or when complications like heart attacks, strokes, or kidney failure occur. Therefore, experts recommend that adults aged 50 and older should have regular checkups and blood pressure monitoring, as blood pressure tends to increase with age. Emergency high blood pressure occurs when blood pressure readings are greater than or equal to 180/120ths of a millimeter of mercury and are accompanied by symptoms such as seizures, confusion, blurred vision, vomiting, unconsciousness, difficulty breathing, severe chest pain. In such cases, immediate medical attention is required. Diagnostic methods. The primary method for diagnosing high blood pressure is through blood pressure measurement. Currently, there are 3 methods to diagnose hypertension. 1. In-office blood pressure measurement. Hypertension is defined as blood pressure is greater than or equal to 140/90ths of a millimeter of mercury. 2. At-home blood pressure measurement. Hypertension is defined as blood pressure is greater than or equal to 135/85ths of a millimeter of mercury. 3. 24-hour continuous blood pressure monitoring. Holter monitor. Hypertension is defined as blood pressure is greater than or equal to 130/80ths of a millimeter of mercury. To obtain accurate blood pressure measurements, it's essential to 1. Rest for 15 minutes before measuring. 2. Avoid smoking or drinking caffeinated beverages for at least 2 hours before measuring. 3. Maintain proper posture, either lying down or sitting with your back supported, feet flat on the floor, arms straight, resting at heart level, and remaining still during measurement. 4. Measure blood pressure in both arms initially, and if there's a significant difference, greater than 10 millimeters of mercury, in systolic blood pressure readings between arms, take a third measurement after 2 minutes. 4. Record the average of the closest 2 measurements. 5. Use an appropriately sized cuff with an automatic blood pressure monitor. Patients with high blood pressure may need the following tests. 1. Tests to identify the cause of high blood pressure, such as renal artery ultrasound, abdominal ultrasound, adrenal gland ultrasound, hormone testing, aldosterone, renin, metanephrines, cortisol, TSH, and imaging studies like CT or MRI scans. 2. Assessments to evaluate the impact of high blood pressure on vital organs, including electrocardiograms, echocardiograms, blood tests, urinalysis, urine microalbumin, creatinine ratio, ankle-brachial index, ABI, fundus photography to assess the eye's blood vessels, and more. Complications of high blood pressure. High blood pressure can lead to severe complications affecting the heart, brain, kidneys, eyes, and peripheral arteries. Common complications include heart attacks, heart failure, atrial fibrillation, strokes, cognitive decline, kidney disease, eye damage, and peripheral artery disease, among others. Warning: untreated or poorly controlled high blood pressure can result in long-term complications affecting the heart, brain, kidneys, and other vital organs. Treatment of high blood pressure. The management of high blood pressure involves a combination of lifestyle adjustments and antihypertensive medications to help patients maintain optimal blood pressure levels. The target blood pressure is typically set at 130/80ths of a millimeter of mercury or lower, depending on individual factors and underlying conditions. Treatment options include: 1. Lifestyle modifications. These include dietary changes, regular exercise, weight management, salt reduction, alcohol moderation, smoking cessation, relaxation techniques, and stress management. 2. Blood pressure medications. There are 5 main classes of blood pressure medications: inhibitors of renin-angiotensin system, calcium channel blockers, diuretics, beta blockers, alpha blockers. 2. The choice and combination of medications depend on the patient's characteristics. 3. Treatment aimed at addressing the underlying cause of secondary hypertension. 4. In some special cases, surgical or interventional procedures may be necessary, such as renal artery angioplasty or stent placement. During treatment, it's crucial for patients to take their medications as prescribed daily. If you suspect any side effects from your medication, do not stop taking it without consulting your doctor. Adhering to the treatment plan can help prevent long-term complications of the condition. To achieve effective blood pressure control, patients are encouraged to monitor their blood pressure at home using a personal blood pressure monitor. This provides valuable information for doctors to optimize medication and care. If you have concerns about your blood pressure readings, be sure to discuss them with your healthcare provider. How to prevent high blood pressure. Preventing high blood pressure involves adopting a healthy lifestyle early on. Many studies have shown that maintaining an ideal body weight, engaging in regular physical activity, and following a suitable diet can help prevent hypertension. 1. Adopt a healthy eating pattern with a low-fat diet, high consumption of fruits, vegetables, whole grains, and low-fat dairy products. 1. Include fish, poultry, and lean meats while reducing sodium intake, processed foods, and fast food. 2. Reduce salt intake and limit consumption of fatty meats and processed foods. 3. Engage in at least 30 minutes of physical activity most days of the week, including both aerobic and strength training exercises. 4. Maintain a healthy weight and lose weight if overweight. 5. Limit alcohol consumption. 6. Avoid smoking and exposure to secondhand smoke. 7. Manage stress and maintain work-life balance. 8. Regular health checkups to detect modifiable risk factors early. Thank